My name is John Ely. I'm a family physician at the University of Iowa, and the purpose of this video is to demonstrate the use of a diagnostic checklist. I'll be demonstrating this with a simulated patient. I have indicated to her that her chief complaint should be dyspnea, shortness of breath, and that she should have a basically negative history otherwise, but I have not gone into detail about the answer to every question that I'm going to ask. So I'll begin now by walking in the room and introducing myself. Hello.
Hi.
I'm Dr. Ely. You're Nina Scott, is that
I
right?
am. Mm-hmm.
Okay. What brings you in to see us?
Well, I've been having this shortness of breath.
Okay. Tell me about that.
You know, it seems to have been gotten worse over the last couple weeks. I've noticed it especially like when I'm, walking up steps or carrying something for a long time. It just seems to be getting worse.
Right. Have you noticed anything else?
No, I haven't.
Any coughing or?
No.
Okay. Any chest pain?
No, there doesn't seem to be any pain with it.
Okay. And any fever?
No fever.
Okay. Just really the shortness of breath?
Yeah.
Okay. All right. Well, I need to check you over. So I guess I need to have you take off everything except underwear and put this gown on, and you can put the sheet over your lap and then just sit on the end of the exam table, and I'll go out while you're doing that, and then I'll be back in just a minute.
Okay.
All right. Well, I didn't find a whole lot wrong examining you. There's no obvious cause for your being short of breath. There are some things that can do that even with a normal physical exam that I think we should check on. One thing that comes to mind is a pulmonary embolus, which is a clot in your lung, a blood clot in your lung. Have you been on any long trips, like plane trips or car trips?
No.
Recently? Okay.
No.
Or had your leg in a cast for any reason? The reason I ask is that might cause a blood clot in your leg that could go to your lungs.
No.
But, okay. Another thing that comes to mind is what's called a cardiomyopathy, which is like a viral infection in your heart muscle. And one way to check on that would be to do an echocardiogram, which is like an ultrasound of your heart. And
Okay.
so I think we should do those two things. I'm not coming up with anything else, given your pretty much don't have any other symptoms or physical findings. But actually, I have a checklist here of the causes of shortness of breath, and I just want to go through it to make sure I shouldn't be thinking about something else or there's something I didn't consider.
Okay.
So asthma, you don't have a history of that. Fever, you don't have. Deconditioning, that just means you're not in good physical shape. Do you get any exercise?
Yeah, I walk and things, so I wouldn't say that there's really been a decrease in that over the last few months.
Okay, so that's not likely. Pneumonia, I don't think is very likely. Physiologic dyspnea of pregnancy, when was your last period?
About a week ago.
Okay. And are you having regular periods?
Yeah.
Okay. Bronchitis doesn't seem likely because you're not coughing. Heart failure, I don't see any signs of that, although the echo will help us determine that. And then pulmonary embolus, of course, is one of the things that I'm concerned about. So we'll actually get a blood test for that. It's called a D-dimer, and if that's positive, then you may need some other testing, but we'll start with that. Myocardial infarction is heart attack, unlikely that you wouldn't have that without some chest discomfort, unless you have diabetes, which you don't.
No, I don't.
You don't have that. Psychiatric hyperventilation, we talked about stress. Have you ever had hyperventilation syndrome before in your life that anybody told you?
Oh, not a syndrome, occasionally. I know what that feels like. I don't think this is the same thing.
Not the same thing, yeah. I would expect that to be more episodic rather than continuous
Yeah.
anyway. Pneumothorax, you don't smoke, so, and you don't have chronic lung disease, so that seems unlikely. You haven't had any injuries to your chest
No,
that you're
no.
aware of? Okay. Cardiomyopathy is one of the things we need to rule out, so we'll get the echo for that. Shock, you don't have shock because your blood pressure was normal. It was 120/70. Anemia, oh, actually I didn't think about anemia. Are your periods heavy or?
No.
Not really?
No.
Okay. We probably should check a blood count
Okay.
anyway, just to be sure. Foreign body aspiration, no. Increased intracranial pressure. Have you been vomiting at all?
No.
Okay. Well, that's my list. So I think we should go ahead with those tests, and then we'll just go from there, see what shows up. So,
Okay.